Are you a dentistry aspirant? Were you newly admitted? Are you still like trying to apply, or you've just gotten into dentistry and you've not reached the clinical aspect and you're feeling like, hey God, what have I gotten myself into? Or probably you are pursuing medicine and then you decided to go into dentistry and they are like, hey God, share wouldn't have been better that I stayed in medicine. It's because you have not been exposed. Now I'm going to expose you. Hi guys, you're welcome back to this platform. If this is your first time seeing my face, my name is Eunice and you're welcome once again. So when I did the last video on how I got admitted into the medical school, I said I was going to drop a video on the courses I studied while in medical school, the courses I studied before I got to preclinicals, the one I did in preclinicals, the one I did when I was in the medical aspects, and then when I crossed to dental school. I'm going to be giving you the details of everything. I remember when I was about to get admission, I wished I could actually just see a video that was going to tell me everything that I'm about to tell you now. But then I didn't get where I read a few things, but I would have wished that I had this one-on-one talk with someone online that could have like given me the gist of what to expect. But well, either ways, I'm happy and I'm in dentistry and it is one of the best things that has ever happened to me. So, without further ado, let's get right into it. Dentistry is a course that deals with the study of the mouth, the structures of the mouth, its functions, the diseases that affects the mouth and everything. And when I talk about the mouth, I'm not just talking about mouth like mouth. There are a lot of things that are in the mouth and they include the teeth, the tongue, the gum, the soft tissue, the salivary glands, the bone, and several other things, nerves, blood supply to the mouth. Dentistry also offers study on some other facial structures. There's a part of dentistry that we call the oral and maxillofacial surgery. So they do surgery, they deal with surgery of the face, the things, the structures in the face, and then sometimes they extend to the neck, depending. Dentistry also helps to let you know because there are sometimes that we've diagnosed some particular diseases based on what we saw in the mouth. There are some diseases in the mouth that are pointers to some systemic diseases. If you have hypertension, if you have diabetes, there are some things that will probably see in your mouth that you might not even know that you have diabetes, even at that point of saying us. But because we saw those changes in your mouth, some things in your mouth, they are pointers to the fact that you could be diabetic. So dentistry is actually a very, very interesting course. And I tell you that I do not regret studying dentistry. So first of all, I want you to prepare your mind that dentistry is a 6 year course. Dentistry is not a 3 year course, it's not a 4 year course, it's not a 5 year course, it's not a 7 year course. Dentistry is a 6 year course. I remember sometimes when I'm going to school, I'll meet some other students within UCH. I stay in University College Hospital now as the clinical arm of my education. So there are some people that they will meet us on the way and they'll be like, oh my God, what school is this? I'll be like, oh, dentistry. They'll be like, what level are you? I'll be like 600. They'll be like 600. I've never heard about 600 before. So dentistry is 6 years. It's not 3 years. It's not 4 years. It's 6 years. You are going to be using the same year as your medical colleagues. It is a 6 year course. So just prepare your parents' mind, your guardian, your sibling, and your own mind too. Yeah, you're going to be in school for 6 years. Then when I say 6 years, you know how it is now. You know how Nigeria runs. Especially if you're in a federal university, that 6 years might also be impacted by strike and breaks, some useless break like currently now. As I'm filming this video, don't say I told you.
We are currently on strike, but I don't like it, but then we move on.
So there are some strikes that will affect it. I entered 2017, but now I'm in my final year, 600 level. 600 level, calculate 6 from 2017 to now. It's probably more than 8 years. When in 2025, that's like 8 years now. But then I'm 600 level and we are still here. Please help us pray. Help us pray, make dem release us oh. Well, so back to the point, just prepare your mind, especially in the federal universities. New private universities are also coming up in offering dentistry. I think Abu had, I don't know another. If you know any other university, you can drop it in the comment section. There are some private universities that are not now offering dentistry. So that's the first thing. Dentistry is 6 years. The other thing is dentistry is capital intensive. You are going to probably spend more money than your medical colleagues because there are some things, some materials, things that you are going to do that you're going to buy. So dentistry is expensive, even if you are studying dentistry in other countries too. And I think that's why dentistry is still not very, very common in terms of courses that people offer in Nigeria, is because you spend money. Even as a dental student, you are going to spend a lot of money, especially when you get to dental school and you start doing practicals. You spend money, but then don't worry, that money will come back. It's going to definitely come back. So that's the second thing. And then the third thing I want to know about dentistry is that when you study dentistry, even though you are going to do almost the same thing as your medical colleagues, you are not going to be licensed to treat asthma, to treat all the regular medical diseases. You are going to be licensed to treat dental diseases alone. Even though you will have the knowledge, because the knowledge is going to also help you in your own dental career. But then you are not going to be licensed to, because some people want to be dentists, then they still want to treat malaria, they want to go and be doing GIT surgery in GIT cardio and stuff like that. Just prepare your mind now. If maybe already wanted to become clinical in medicine, if you are going the path of dentistry and you feel like you cannot change your mind, just go and stay with medicine, because when you're in dentistry, you are doing dental work, but you are definitely going to enjoy it. The last thing I want to establish before I start mentioning the courses is that you are going to be paid the same thing as your dental colleagues, if not more. If not more, abroad, their dentists usually get even higher pays than their medical colleague, but you are going to be paid the same thing. You are a doctor, so you are going to be paid the same. I know a lot of people want to hear this again. That's why I kept emphasizing
You are a doctor. You are a doctor.
you are a doctor. So you are going to be paid the same thing as your medical colleague. And even if you are abroad, you are going to get higher pays. So, but the pay depends on the level, because in careers we have like level, cadre, and all. So the pay is in level. So that is it. Let's go straight into the business of the day. And that is the gist about the course I studied in a federal university. So I am a student of University of Ibadan. When I came in, I studied the preliminary courses like the chemistry, the biology, but it's not called biology, it's zoology. Zoology is like biology, or like biology in an advanced level. So we did zoology 114, zoology 112, chemistry. So they put chemistry like code for us. I remember chemistry 126, chemistry 156, and we did physics. So they basically, for each semester you do like two chemistry, two biology, two physics, but it's divided in sections. Just like one of the zoology was like animal zoology, all these general kingdom class, stuff you will name. That one you are going to name things, a mastigophora, zoo mastigophora, a whole lot of things there. So you're going to be having to name a lot of things in that time, in that season. So then for chemistry, there is organic chemistry. I'm not sure if I can remember vividly now. I think chemistry 156 was organic, while the 126 was the elementary chemistry. But you are going to study all the normal sciences that you have studied before in your secondary school on an advanced level, in an advanced stage. Then you study physics too. So you offer physics, chemistry, biology. Those are the main course. And let me just give this for those that are coming to UI. If you are coming to UI, just prepare that your first year is going to be plenty people, because when we came in, there's this hall, CBN hall. People from UI can relate. That CBN hall has over 1,000 capacities, and that was where every of the science students took their lectures when we started. So if you are not used to seeing crowds, seeing a lot of people, please buckle your shoes and tighten your belt, because we are going to have to be in class with a whole lot of people. But then you are going to survive. So chemistry, physics, biology, and even though you are offering those courses, you will do practicals too. There will be times where they will incorporate practicals, chemistry practical, biology practical, physics practical. It's called zoology. So if keep saying biology, it's zoology. So you do those practicals, and then after on, they are going to, like, you do tests, you do exams. So after that exam, that's when you now move to your preclinical phase as a medical student. And mind you, when you were in the 100 level, you are going to be having the same class with them, medical students, nursing, pharmacy, every science course. Everybody is literally taking their lectures there. But then when you now move to the clinical part, both the dental students and the medical students are going to be moving to that preclinical phase. And the preclinical phase, you are going to be having your lectures together, dental student, medical student. In fact, at that phase, nobody will know if you're a dental student or you're a medical student. It's later in life. I remember some of my friends, it was when we crossed to dental school and they no longer see me in the group. That was when they realized that, wait, she's actually a dental student. So you are going to be having your lectures together for a whole, like, long period of time before you all, like, separate. So the preclinical phase. This is the phase I love the most. I actually didn't like the elementary phase because we had to keep learning things that I know that I might actually not need. Like all those naming. Now I can't even remember like 70% of those names again because they did not really apply to us. I'm this kind of person that if something doesn't interest me, I find it difficult to, like, retain them in my memory. So I didn't really enjoy my 100 level, although 100 level is a level to enjoy because as you go higher, the work gets higher. But then let's continue with that. Just preclinical phase. So in your preclinical phase, you are going to be offering anatomy, physiology, and biochemistry. I don't know if you've ever heard of these courses before, but I'll just break them down into like simpler terms so that you can understand. Let me start from anatomy. Anatomy is the study of structures, and in anatomy, we have four branches of anatomy. We have the gross anatomy, we have the histology, we have the embryology, we have the neuroanatomy. But then, as a dental student, you have a fifth branch, which is the dental anatomy. Why I say this is because you just realize that you are even going to read much more than your medical colleague in this stage because you are offering an extra course that they don't offer. Let me just start from gross anatomy to make it easier. Gross anatomy. In gross anatomy, you are studying the body from the crown of your head to the sole of your feet. Every single thing, how it's related to another, the skin, the muscle, the nerve, the blood vessel, the lymph nodes, every single thing that makes up a human being and how it is related to one another. That is what you are studying in gross anatomy. So they probably will take it system by system for you. In my school, they start with upper limb and lower limb. That's when you are going to find out about Kate Moore. Well, maybe you have heard it before, but now you're going to have to read Kate Moore and then some other textbooks. But in anatomy, gross anatomy, we are learning, for example, the upper limb and the lower limb now. From your shoulder, your clavicle, your shoulder, the joints, the muscles, the nerves, the blood supply, how one is related to another, the one that is in front, the one that is at the back, the one that is in between, the one that is lateral, the one that is medial. You're going to study everything, every single thing. So get ready for new terms, get ready to be exposed to newer dimensions. I remember before we resumed preclinicals, they were like, oh, make sure you finish the first 70 pages of your kit more. The first page self, he had, but now looking back, after you have acquired knowledge, after you have been able to like sail through all these things, you now realize that they are actually very, very simple. It's just because you have been exposed to new things. So, well, that's it about gross anatomy. Let's move right into another thing. Histology. Histology. That's the next thing. Histology is the study of the body in its minutest detail, that is cell in the cellular level. So all these body structures that we have studied in gross anatomy, we are going to study them in their minutest detail. The cells that makes up the skin, that makes up your heart, that makes up your organs, whatever organ, liver, kidney, the muscles, those the cells that makes up the muscles, the cells that makes up the fats, that makes up fats in your body. Every single thing you are going to be learning them under histology. Then we are going to move to embryology. Embryology is the study of you from when you were 1 day old in your mommy's womb to some days after you've been given birth to. So it's literally the study of the growth of humans, the structures that are present at each stage of their growth. For example, you are going to learn how the kind of structure you have at 1 day old when you were in your mommy's womb, 2 days, 3 days, 1 week, 2 weeks, 3 weeks, 4 weeks. By fourth week, then they start teaching you those structures in terms of system. For example, at fourth week, which organ would have started developing, which organ would have started maturing, which organ would start growing at 5 weeks, at 6 weeks, what organs, how do they grow, how do they form, how do they come about. So embryology is so so beautiful. Like, makes me appreciate God so so much, because God is definitely so great. God is so great. God is so mighty. So God is very good. Like, I just, when I'm reading, I'll just be like, "Ah, God, God, hey." Well, that's it about embryology. Embryology is very beautiful. So you're going to be learning that. And then neuroanatomy is the study of the brain. You're going to be studying the brain in its like fullness. You're going to be studying the brain in its fullness, the things that makes up the brain, the components, just like we're doing in that histology, the things that are in the brain, how you the way I'm holding a fork with a mic and I'm talking, what happens, how did it happen, how did it come about, what area of the brain is responsible for it, what area of the brain is responsible for hunger, for appetite, for desires, for pleasure, for different things, intelligence. You are going to learn everything, the things that allow you to feel if they pinch you, how you will know that, okay, it is nail that pinch me, it is pin that prick me, it is knife that cuts me. Those things that will help you to know that, okay, if I taste something, this is how, that's how, what neuroanatomy is all about. It's like studying the brain and how the brain helps you to feel or helps you to move your different part of the body. It's actually very, very beautiful and interesting, but it can be a whole lot of things. Then we are going to move to that fifth branch, which concern you as a dental student, and that is the dental anatomy. So even though everybody's in the same class taking the same courses, at a particular time of the day, only dental students will be taking dental anatomy in addition to everything that you are all taking together. And now, this dental anatomy is about the mouth, the teeth, the structures that makes up the mouth, that makes up the teeth, the bones, the tongue, all those things, the glands. You are going to be learning those things in their very basic level. You will learn them, the teeth, the way you see the teeth, the things, the layers of the teeth, the things that makes up the teeth, the roof of the teeth. You will learn everything in your dental anatomy. So that is it about anatomy. So let's move to the next thing, and that is physiology. So physiology is the study of the functions of those body parts that you have learned in your anatomy. And physiology is also very beautiful. I like the way my school make the structure. As you are learning a particular system in anatomy, you are learning its function in physiology. Be able to match both the structure and the function together. Is that not very, very beautiful? So for your physiology, you are going to be learning the functions of every single system in the body, every organ of the body, how it works. You will learn how swallowing happens, how your food gets to your stomach, how it is digested, how it is turned to feces, how it's absorbed into your body. You will learn about the heart, how the heart pumps, those things that make up the heart, the fluids, the a whole lot of different things, the head, the brain, the eyes. You are going to learn the functions of those things, and not functions that, okay, it is used to saying, more like the mechanism of how they happen. Oh my god, I'm emotional because it is actually very beautiful. I'm actually even sweating. Let me find myself small. So physiology will help you to know how all those body parts works, how all those body parts function to make you a living being. Then we go to my least favorite subject. I don't know how many people can relate to this, but I know that most medical students can, and that is biochemistry. I don't like biochemistry, but I'll tell you what biochemistry is. Biochemistry is the study of the chemical components of the body and how it works. So yes, we've talked about the anatomical structure, which is the gross anatomy, histology and all. Then we've talked about the physiology, the function. But then this is like studying the body in its cellular and chemical aspects. So how the chemical aspect of the body allows the body to work. So in chemistry, you are going to be dealing with a lot of pathways, a lot of cycles. You'll be hearing Krebs cycle, TCA cycle, and a whole lot of cycles. You are going to be dealing with pathways, metabolism of this thing, metabolism of that. I don't like biochemistry. It's God that saved me in biochemistry. I don't like biochemistry. And I want to pray that in biochemistry, the Lord will help you. The Lord will help you. You're not saying me. Now you sad. So that is it about the courses that you are studying in preclinicals. But let me just touch on the examination in preclinicals. In preclinicals, you are going to be writing tests even while you take all those courses. You would take all those courses simultaneously. There will be a schedule that will incorporate all those courses for you, and you will take it simultaneously. But after everything, you are going to be taking tests. You will take in-course exams, you will take tests, you will take practical exams, and then you will take your professional medical board examination. Yeah, they are going to do that. So for preclinicals in a federal university like mine, it spans 1.5 years. That means the whole of your 200 level and then the half of your 300 level. At the half of your 300 level, that is when you are going to be writing your professional medical board examination one. That is your part one examination. And in your part one examination, you are going to be writing MCQs, multiple choice questions. You will write true or false questions. UI has a way of doing true or false that, hey, God, but you are going to be fine. So true or false questions, you write true or false. You will write essays. Your essays will be like 8 questions that have stems and branches. And then you are going to do practical exams. I don't know if you've ever heard of OSCE before. OSCE exams is a form of practical exams where you go from one table to the other at a particular under some minutes. For example, let's say maybe 2 minutes. For every 2 minutes, you are to move from one table to the other to answer questions based on the structures on the table or on the questions that are being asked on the table. So is you and your specimen, is you and whatever it is that has been placed in front of you, and whether you know it or whether you don't know it, after a particular amount of time they are going to ring the bell and you have to move. So that's OSCE exam. And then after your OSCE exam, which is your practical exam, you will do an oral examination where you are going to be meeting with your lecturers and your external examiners one by one to answer questions. So that is it about the preclinicals. I enjoyed my preclinical so much. It was a whole lot. It was a lot. Maybe in another video, I'm going to tell you my story and how I survived, but it can be a whole lot. But I tell you, you are going to survive it. So just tighten your belts, and with God on your side, you can do wonders. So this is going to be the end of the part one of the courses I studied in dentistry, and I'm going to be going to the part two in subsequent videos. Thank you so much for watching. Don't forget to like and subscribe to this channel. Thank you. Bye. I studied the preliminary, the pre what have I gotten yourself into, so that you're able to match the same you are going to, so that you, and not functions that okay it is used to saying, more like the mechanism of how they happen. Oh my God, I'm emotional because it is actually very beautiful. I'm actually even sweating. Let me find myself small. I'm sweating because I'm actually very emotional. But okay, there's lights. I need fan, but I don't want this fan to be like making noise in my distance. Okay, let's hope that it's not going to like be making a whole lot of noise.